sessions. And, I was so excited when I got this book. It's called Skin Sense. And of course, when I flipped through it, there were certain things I said I must do. And so I am going to tell you what I did. And please get all your questions ready because she's going to take lots of them. And as we tell everyone, we take questions in order. So Dr. Kiran Sethi, she's an MD. She gives cutting edge advice on how to take care of our skin and how to fight the signs of aging, and provides us with hacks for a perfect skincare routine. From serums to retinols to collagen, vitamin A. She's going to give us all the tips and tools. She's also going to demystify for us all the products that are available in the market, and there's so many. And she's also going to give us some nutrition-based tips that will ensure that we glow from inside out. And as you can see her, she is glowing. So we're going to definitely get to the heart of that. And my first question to her, Dr. Kiran, a very warm welcome. First of all, welcome back from your holiday, and tell us, how do you glow and what do you do on a daily basis?
Oh my gosh. Okay. So what I do, it keeps changing, but I typically use some sort of vitamin C serum. I use a really heavy moisturizer. I use a lot of sunblock, whether I'm indoors or outdoors. And right now I'm using adapalene, which is a topical retinoid. And I use that at day or at night. And again, a heavy moisturizer. Then I also do facials. So
when you say a heavy moisturizer, what do you mean by that?
I mean, right now I'm using like a skin protection balm. It's like a thick balm that, actually feels very nourishing. The more moist your skin is, the younger it is, the more supple it is, right? So I very aggressively moisturize, but I'm very dry, and I also use things like adapalene, which will make you more dry. So that's why I use that. Then I do facials. I do laser facials. I do things like skin boosters. I do microneedling. So once a month, once every month or 2 months, I'm doing something. Although I will say that during the lockdown, I did almost nothing. So now I'm going to reversing what I destroyed over the past 2 years, which I've been in and out of this lockdown situation, but that's a separate thing.
Congratulations on your book. So what made you want to write down all your secrets in this book?
I felt like, first of all, I don't think that we should keep too many secrets. It's like, that's one thing. I do think that I hate seeing people feel misinformed. I think that's great to be able to provide easy to use information for people, wherever they are, wherever they go, and things that are relevant for Indian skin, because, it's different, right? We're different than Koreans. We're not, Caucasian.
But now you bring that up. We're different than Koreans, but we're obsessed with Korean beauty hacks.
I know. And I'm just like, I get it. I get the Korean dramas are also great and their skin looks great, but we don't have their skin. We're not poreless. Korean pores are much smaller than Indian pores. Okay. And also their weather is really different. Go to Korea. You're not going to sweat like you just like entered the like a sauna. Okay. Like Korea's different. This is not Korea. So we can't use the same skincare. We can't have the same concepts. So that's why I just felt people should have an easy reference. Now, you can't be a doctor, right? Like I went to school for decades. So, there's no book that can teach you to be a doctor. And there's no book that can teach you to take distance from your own problems, right? Because it requires some distance. Otherwise, your emotions will make you make mistakes.
And overtreat. Because I think one of the biggest things is we want to try everything, because we go to Google and we say, okay, here's a problem. And let me try it. And we don't have the patience to wait for some of the results.
Exactly. And also, people go to Google and it's like their fear makes their brain stop working. They'll read Google and all of a sudden it's like they don't no longer have brain cells. Like they just stop because it's just the fear. And fear is very common to do that. It overtakes you and you can't think through it and be logical, right? Like you'll read something and then you're like, oh my God, what if this could be the thing? And then the concept is that then I'll be destroyed. But it's really hard to destroy your skin. Your skin is the largest organ of your body. It's genuinely really hard to destroy it.
Well, that's good news because we feel that actually it's something that we should treat very, very fragilely.
Well, you should care for it, but you can't be terrified that something's going to mess it up all the time.
So tell us, because of course, you've written so much, you've written by age groups, but is there a must do for every woman? And what are your top tips?
A must do.
And guys, like I said, if you have questions, please start putting them in because we're going to take the questions in order as they come.
A must do for everyone is wear sunblock. I can't think of any bigger must do, right? There is no bigger must do. than wear sunblock, because
When you
I started wearing sunblock when I was like 12. And I really see my skin is more resilient for it. It's healthier for it. It's younger for it. And my skin is better than my mom was at my age, right? My skin is better than my grandmother's was at my age. So whatever I've been doing is clearly working.
So when you say that at age 12, so when kids are going to school, should we be putting sunblock on them also?
I've been putting my sunblock on my
12?
daughter from the age of 4. I started age 4 or 5. I started very religiously doing it at 5, but 4 I would do it intermittently. But yeah, and she's very clear. She's a well-trained girl. She's like, Mama, I have to wear my sunblock. Mama, you know, and Mama, I need my cream. And she makes sure to put her cream on. She puts her sunblock on. She's very clear.
Very nice. But when you talk about sunblock, anything specific about the sunblock? I mean, because there's so much SPF, this, that, the other, is there something that we should keep in mind? Because that is your number one tip, that whether we're inside the house, because I think this is the big, when we think we're inside the house, we don't need sunblock.
Okay, so I do think you need sunblock when you're inside the house. I, as a rule, just make sure I wear sunblock every morning wherever I am. I don't care if I'm indoors. I don't care if I'm outdoors. I don't care if it's snow. I don't care if it's raining. I don't care. I just wear my sunblock and I don't think about it anymore. And I do my best to reapply it in the afternoon. Again, I don't care where I am. Look, I love the sun. I love my windows open, and UV light penetrates through windows. You're sitting in a car, UV light's penetrating through those windows. Why do you think one side of, if you spend a lot of time in your car, you'll find one side of your face, the side that you sit on, is darker than the other or has more pigmentation? It's showing you, it's proving to you how much UV light penetrates through your windows. So don't assume, you know, like that somehow you're safe because you're at home, or because it's raining, or because it's snowing, or you know, because it's you're indoors. Doesn't matter. Unless you're in a dark black room, you're not safe. So
And how many times did you reapply your sunblock? I'm just asking this because
I think twice. I think once in the morning and once in the afternoon is fine. I do think that I prefer mineral sunblocks. I think that they're better, safer, and also they're just the safest thing to use on yourself or on your kids. But you know, the thing is they leave that white cast, so it's annoying, right? But it takes 15-20 minutes to absorb, but it does. So personally, to me, I would prefer mineral sunblock. If you can't handle it, but you want to wear a sunblock, then use a chemical sunscreen. But you know, those absorb really fast, but they take 30 to 45 minutes to work. So you have to apply it 30 to 45 minutes before anything.
now SPF on the sunblock.
30. So there's 2 types of sun protection. There's UVA and UVB. UVA light is what causes pigmentation and aging. So UVA light is the PA rating. So there's PA++, there's PA++, there's PA++++. So you can have PA++ and above, and that covers your UVA. Now your tanning and your skin cancer comes from UVB. So that's your SPF. So for me, I find SPF 30 is enough. You don't, SPF 30 to 50 is fine. That's the more, remember, the more SPF you have, the more of the sunblock or sunscreen ingredients you have to use, but it only increases the protection by like a few % against the sun. So to me, SPF 30 is enough. And then you sort of don't have to use as much SPF agents. It's not as tacky. It's not as difficult to use. And you're only like worried about extra 3% protection if you're up to SPF 50. So SPF 30, more than fine.
Got it. So we've got the number one tip. Now, what's your number 2 tip? I'm going to get your top 3, and then we're going to go into the questions.
You know, my number 2 tip is like not to think that somehow you can do some magic regime and then never have to do anything again. That's not how it works, right? Like, just like a healthy diet, you can't just like eat really healthy for 3 months and then then all of a sudden your body is immune to junk. That's not how that goes. You need regular care. If you're doing a skincare routine, you will want to do a skincare routine for the rest of your life. Don't assume there's a magic bullet that is an easy way out. There is no easy way out. You will age. You will have sun exposure. You will have stress. You will have bad eating days. You will have hormonal changes. You will randomly do some home remedy that will mess your face up. You will have all of these things, okay? So, you know, like, there's no reason why you shouldn't maintain and protect and prevent. So whatever it is, whatever concern you have, even if it's just maintenance, have a skincare regime. If it's every 6 months, you change it. Every year you change it. Every 3 months you change it. Whatever it is, but have a skincare regime, because that will serve you for life.
And your number 3 tip.
My number 3 tip. Don't really focus on your diet. Your diet is very key. People think somehow the skin is separate from the diet and is separate from your mood. You know, there's more and more data every day coming out that says do not separate out each body part into different things. Your skin will relate to your heart, will relate to your emotions, will relate to your feelings, will relate to your gut. What you're eating is extremely important. What you're feeling is extremely important. If you're suppressing what you feel, it's going to come out on your skin. Eczema is half the time eczema flare has to do with stress. So not half the time, but certain percentage has to do with stress. Acne, stress. You know, so don't think that somehow your emotions and your food habits can be divorced from your skin. Eat healthy, avoid high glycemic foods, reduce dairy. You don't need that much dairy. Eat clean, unprocessed foods as much as you can. Lots of fruits, lots of vegetables, lots of nuts, lots of seeds, a lot of water. Okay. I mean, basics, but you're doing yourself a service. And the last point I'm going to have for you, the number 4 point, is don't have such high expectations of your skin. Your skin is not designed to be perfect. We were frankly, before the 1930s or 1900s, we were dead at the age of 30. Do you think your skin was designed to be perfect? No. The average lifespan was 30 something. People had terrible teeth, they had tons of acne and tons of problems. Your skin's actual function is to be an envelope and to protect you and to express. It protects you from the elements, it protects you from pollution, it protects you from infection, it protects you from allergens, but it also prevents you from getting all of these problems. It also helps temperature regulation. It also expresses. So if you have diabetes, your skin's going to tell you, you're going to show pigmentation on different parts of your body. If you have PCOS, your skin's going to tell you, your hair is going to tell you. It's an expression. It's saying what's wrong. A lot of signs of cancer, internal cancer, can show up as these random skin signs. There's something called the sign of Lazare-Trezot, something like that. But, you know, like it actually shows up as this random outcrop of random things. Your skin is a beautiful expression mechanism. So don't think it's not actually supposed to be perfect. That's not its job. Its job is to protect and express.
So now that you've touched this topic, how do we know that if our skin is healthy or not? Because that's a big question that we have, because you go to these malls and they'll put you through this fancy gadgets and say, look how much you're aging.
But that's aesthetic. You are going to age, right? Yes, you can prevent, you can reduce, you can make yourself appear better, you can make your skin genuinely younger, but that's not about healthy or not. The health of your skin is independent of the appearance. The health of the skin has to do with how well it is at protecting you from damage and how good it is at temperature regulation. That's what the skin is for, right? Is it resilient? Is it healthy in that way? Is it doing its job? Its actual function is not to look pretty. So that is a separate added thing that we're looking for. Now that is aesthetic. Now that's your choice. Do you want to reverse time? Do you want to make your pores better? Do you want your scars to go away? Do you want your skin to look brighter? That's your choice. There is no dire, absolute devastating need to do it. But if it pleases you and you want to do it and it makes you feel good, by all means, go for it. But don't allow anyone to freak you out into making you feel bad about yourself, because that's about you. You can actually recognize that, oh no, I want to feel good. And that's a choice that I am making for myself. And that's a separate thing.
So you take a quite harsh view on food, especially, and specifically on vitamin cocktails. Tell us, because we are looking at a whole slew of hair vitamins, beauty vitamins, skin vitamins, collagen vitamins. What's your take on that?
So I think that what's happening is that we're getting like big marketing productions and slews of concepts, but the reality of what things are working is not there. There's great data to suggest that multivitamins actually don't work. They don't help. They help in an elderly population that barely eats, but in the normal population that actually eats, like multivitamins are really doing nothing. And frankly, it makes sense, right? They use so little of each vitamin. Somehow they've magically combined all the vitamins together in this one tiny pill. I mean, how much can you really absorb? It doesn't even make sense in an intellectual, logical way, right? In my book, there are certain supplements that I've seen work. There are certain hair supplements I've seen work, and that's fine because they have a lot of trace minerals where you don't need huge quantities and you actually don't get them much from your diet. That makes logical sense to me. But, things like gummies with random vitamins with low percentages in them just are like marketing tools. They taste good, they look really pretty, and they make you feel good, but they're actually offering you no long-term benefit whatsoever. So
if you're going to take vitamins, what should we do? Should we have a blood test? Should we visit a doctor? I mean, is there a protocol?
There is a protocol. If you want to take vitamins, do it with the doctor. Because at the end of the day, there's still a vitamin is not some natural, is the word natural. Again, I want to talk about natural after this. A
Yes,
vitamin
please.
it doesn't have zero toxicity. Some people have been popping zinc for like years since COVID and they have zinc toxicity. Some people are popping vitamin D, B12, they have vitamin B12 toxicity. I mean, no, why? A vitamin is still medication, right? A supplement is still a medication. They all have side effects. I've seen so many side effects from supplements that people have randomly been taking. I recently had a patient and she was like, oh, she was so concerned that she had this random flushing and she kept thinking it was her skincare products. And I sat with her and I was like, no, let's actually get into what you're doing because I have learned now that people are doing a lot of random things. Okay. And then it turned out she started taking this supplement. She heard about it.
And we're told about D3, you should take one. We're told about everybody is, deficient in B12. If you're a vegetarian, take it.
And honestly, all of her problems started when she started taking the supplement, but because she thought it was a natural supplement, she couldn't imagine that this was the cause of her problems. And she had decided that all of the lacks of worth of products were problematic, but it had nothing to do with them. You know, it had nothing to do with it at all to do with the supplement. Stop the supplement, all of her problems went away.
Wow. And what are you speak a lot about superfoods. So what are the superfoods that we should add to our diet? And what are those things that we absolutely need to cut out?
So again, when I say a superfood, I mean that they're full of antioxidants, but I don't think there's anything magic. There's no magic food. It's not like magically if you eat kale, you're going to be super healthier. I mean, you ate kale for like a day and then it's not like, wow, I'm looking great, right? Like, how does that make any sense? If you eat kale, you'll have more iron, you'll have a lot more healthy like astaxanthins and great antioxidants, and that's wonderful. But, you can also have, if you don't have kale, you can have spinach, right? These are the range of things. It's about having a healthy plate. There is no magic. There is only science and logic. If you're looking for magic, that means you're looking for an easy way out. Have you ever seen an easy way out give you long-term results?
We hope so. We were hoping you would tell us it.
There's no magic bullet which will solve all of your problems and no magic food that's going to make you perfectly resilient. It does not exist. It takes work. It takes a lifestyle change. It takes a good regimen, and that gives you long-term results. Every patient I have that understands this has great results, has good skin, is healthy, and is living a good life. Everyone that's randomly out there buying the latest product, the latest supplement, the most exciting superfood, and is having like 7 tablespoons of manuka honey is not that way. Okay? Easy way out doesn't work.
So there's no superfood or super pill that we can pop every day.
No, don't look for magic. There are certain things that help. Does a glutathione and vitamin C antioxidant or N-acetylcysteine, does it help? Yes. Is it going to solve all your problems? No. You have to use a measured approach. It's like buying a lottery ticket. If you randomly think that beautiful collagen gummy is going to make your hair grow until it's like, the Amazon forest, what do you think? It's like, come on, what's the likelihood? Maybe you're that one person it really worked for and that one person told 7,000 people, right? But that's it. The 7,000 people didn't get that result.
Now tell us, what are the things that we should absolutely cut out of our diet? Are there certain things that we should say no to?
Sugar, diet sodas, although I love Diet Coke. So I cheat with the Diet Coke every so often. Oh, it's so good. It's hard.
So sugar is the big one.
Sugar is bad for you, man. It causes so many problems. It ages you. It gives you acne. I mean, it triggers PCOS. I mean, the list is long. I talk a lot about sugar and how bad it is in the book, right? There's a big whole section on it.
And what about, I think you do talk about Botox and fillers, but there's a lot of stigma still associated with it.
Yes, there is stigma, but I think the stigma is getting less and less, and people are just more practical. It's just another tool in our armament of treating the things that bother you. That's it, right? There's so many different tools out there. Who would have thought that IV drips would become so popular? That's another tool. Who would have thought that laser facials would become popular? That's another tool. Who would have thought that, gummies would be vitamin gummies? I mean, it's the same thing. It's just another tool in our arsenal to help, or another thing that can, assist you. That's it.
And what about intermittent fasting? You talk about that also quite a bit in your book.
I like intermittent fasting. I think it works for a lot of people. Some people cannot do it, and you have to work with your body. Another thing I say is that there is no hard and fast rule for 100% of the population. Everybody is its own individual genetic code, right? We are all actually, every single human who has ever lived has its own individual genetic code. There's no way in hell that the same can hold fast for all of us, right? We're all these special little beings that exist on this earth for this blink of an eye. So, listen to your body. It's intermittent fasting might work for you. For me, I can do intermittent fasting every so often, but I can never do it when I'm PMSing, right? Like that first week, that's not possible. I would rather die. But there's some people who can do intermittent fasting like no matter what. There's some women that cannot do intermittent fasting at all. There's some men that cannot do intermittent fasting at all. There's some men that can do like 24-hour fasts and they're great. It's very personal and it's about what works for you.
You treat a lot of celebs and they have a lot of time. I think most people struggle in the sense that what is this? How can we do all of this when we have limited time and possibly limited resources?
So I actually think there's not much you have to do. And as somebody who runs a clinic like this, I know myself, I know how little I do, right? I know that I spend a few minutes in the morning, a few minutes in the evening. I eat as healthy as I can, or I try, except for my my every so often Diet Coke.
I love Diet Coke too.
Oh, okay. But, and then I do something for myself once a month, right? I give myself that 1 hour every month or 1.5 hours every month. And that's it, right? Except right now where I really need to not give myself twice a month, but still I'm doing only once a month. That's it. We spend a hell of a lot more time on our phones, right? Scrolling through Instagram. Why is that more important? We're escaping from ourselves. We're escaping from our lives. We're needing constant comfort. But rather than just take 1 hour a month away from your phone or away from whatever and use it, or away from the ways that we use to make ourselves feel better and use it for making yourself actually better.
And you talk also in your book of some things that are definite no-nos and things we should throw out, like derma rollers, XYZ, that just don't work at home.
Yeah, I don't think derma rollers do much. I mean, they're fun. They're pretty. Like sometimes you can put it on the sheet mask and it helps absorb a bit, I like it when you add it onto things every so often, but is that solving your problems? No. I think that most of us are short on time. If you're short on time, then you want to do the things that have the maximum efficacy in the least amount of time. And I think 90% of us just are that way, right? Celebrities are different. Celebrities have more time because that's their job. That's actually their job to look a certain way. So that time has to be built in. My job, for example, is not to look a certain way. My job is to treat people and to help people. But I still like to look a certain way, so I'll do the work for it. It's from my own pleasure. It's about me.
It's also self-care. So let's delve into some specific issues and then we'll take audience questions. Acne, what's the best way to deal with it? Because that's big question.
Cut out dairy, cut out sugar, cut out whey protein, and start a regimen with the doc.
Dark circles.
Depends on the type of dark circles. If it's aging or if it's genetic, you need a treatment. There's no cream that's going to magically do it. If it's pigment, you want to avoid rubbing the area. You want to avoid doing this. You want to wear sunblock. If it's fine lines, again, usually treatments. If it's a combination, if it's bags, surgery. There you go.
Wrinkles.
Wrinkles, topical retinoids, bakuchiol, peptides, antioxidant skincare, lots and lots of sunblock. Laser facials are wonderful. Ablative lasers are great. Botox.
What about Ultherapy?
Huh?
Ultherapy.
I love Ultherapy for lifting. It's wonderful. You do it once a year and a half. It gives you a nice lift. Takes about 3 months to show, but it's a beautiful, beautiful treatment that I really enjoy.
Hair loss. And this is the one that I tried of yours, where you recommended the red light treatment, the hair helmets. And honestly, I've been doing it for 2.5 weeks, and I can definitely see a difference.
It's so great. It's something you buy, you can keep at home. A lot of clinics, they offer it because people don't know that you can just buy the thing and do it at home. It's cheaper for you, less time consuming. You can put that helmet on or whatever is that thing, and you can watch like TV with it. It's like you're taking care of yourself and you're watching your favorite, and you're watching Anatomy of a Scandal, which is like such a fascinating show.
Oh, it's amazing.
so good, right? So like, you know, like you could do, I love it. Of course you feel like a retard. My daughter looks at me like I'm crazy, but like, you know, I'm like, okay, what are you gonna do?
What about all these light therapies? Because you do talk about that and you talk about some of these gadgets also in your book.
I love gadgets. I think that there's a lot of stuff that's interesting, like home microcurrent for tight facial toning.
Talk about this home microcurrent, because that caught my curiosity, because that's the next thing I wanted to actually think about. And
Yeah,
then we're
like
going to go to hair frizz.
the new face is great. It's a great, like, I mean, they have this home microcurrent. You can actually feel your face get tighter. We have a professional microcurrent machine. So it's obviously, you know, stronger, but you can see your face get tighter. Like it's awesome. And it's just about tightening those muscles. It's a wonderful thing you can do at home. And LED masks are great add-ons. You get an extra glow. It helps reduce inflammation. I mean, there's such great things you can do at home when you're free, right? You can do it before you sleep. It's just so cool, the things that now we can do on our own.
And what about sheet mask? Because you talked about that too. And I know I'm going to come back to hair loss.
Look, I have facials that have sheet masks in them, but I'm using them on a specific purpose. I've already done XYZ care. Then I've put a sheet mask on top to help infuse whatever else is in there, right? But sheet masks at home typically tend to be this one-off thing, like use a green tea sheet mask. What magic do you think you're getting from a green tea sheet mask that you're going to use once a week? I mean, come on, you know, like it's again, such marketing. It's all marketing, but it's no substance. I love substance. I want to do things that, you know, if you're at home, you only have so much time. Again, you want to do the things that are substantive. Everything else is extra. That sheet mask make you feel good for an hour or maybe a day. Okay, but is it long-term helping you? Probably not.
And hair loss and hair frizz. And then we will take audience questions.
All right, so hair loss depends on what kind of hair loss. Is it vitamin induced? Is it, you know, is it post-COVID hair loss? Is it balding? Is it female pattern balding? Is it male pattern balding? Is it alopecia areata, which is what Jada Pinkett Smith has? What kind of hair fall, right? Every single type of hair fall has a different way of treating it, and it usually can actually benefit the patient in many different ways. So we're pretty happy with that, right?
And hair frizz. And then we will take.
So yes. I like collagen supplements for hair frizz. I also think proper hair care is good. And coconut oiling, which is the classic Indian remedy, is also really lovely, right? Coconut oiling is great. I do think that all the hair treatments we do, like the keratins and the perms and the hair coloring, that damages your hair. The constant touching of our hair damages your hair. Constant blow dries damages your hair. You will get more frizz. Actually, hair screens, which nobody uses, they're wonderful. They actually protect against the sun for your hair. Because if you notice, the top layer of your hair is always crappier than the bottom. That's because of sun exposure and also more trauma. So when you use those hair screens, that's a great little tip and trick.
So I'm asking Suman to unmute. She had a question. Is there any herb or DIY that acts as a sunblock?
No. There is an oral sunscreen, which is Polypodium leucotomus, Polypodium leucotomus, that gives you an SPF of about 8, but that's not enough.
And Alka is asking, let me see if she's unmuting. Go ahead, Alka.
Yeah, you know, I have a very sensitive and a dry skin. And like for 5 years back, I had no spots, no melasma, nothing. Suddenly they started appearing. And now it's like, you know, I just can't, I don't know what to do. My daughter gets me beautiful vitamin C serums and hyaluronic acid and everything, you know, nothing works. I break, you know, I start getting some rash because I have allergic also. I get hives, so I use anti-allergen stuff basically, but still.
You should get patch testing done to see what ingredients.
What testing done?
Patch testing to see what ingredients you're allergic to.
Pardon, can you just spell it out?
I'll type it. Patch testing. Yeah. You can see what ingredients you're allergic to. And then melasma, you should go to a doctor. Like, don't.
I went. He said there are treatments we can do, but it might come back. Then he told me to use Bioderma Mucin for washing my face, which I'm doing. And luckily with that, those white. It's like a white thing, whatever he called, that's not coming back.
So the thing is I can't give you like a consult right here, right? But what you should do is.
No, but you are in Vasant Vihar, right?
I am in Vasant Vihar.
So I will take an appointment. My sister's coming from Calcutta. She's also interested. And, wool therapy, do you do it? Because my friend was asking me, she's coming down in June. She was asking, so I'm sure you'll be good for it.
You do.
Yeah.
You must
And what was
understand.
the dappling thing you were saying? Because it's very dry, my skin, you know.
You can't do a dappling. Please don't do a dappling.
Okay.
For,
Okay. No, because your hair, your skin has a
Your skin is
glossy look, you
absolutely
know.
glowing. So we're just
No,
looking at
and
you
it's
and we
glossy,
want to
you know.
know that what do you
Prakriti,
do?
it is like shining and glossy. My daughter's skin looks like this, you know, spotless and this glossy and shiny.
everything is, you can do a lot. Melasma is treatable. You have to maintain it and prevent it. You have to wear a ton of sunblock, 2 tablespoons, whether you're indoors or outdoors, on your face.
Yeah, that I'm doing. I'm using a solar because that's the only one which suits me, you know,
Yeah,
the solar one.
Yeah, there's a lot of work with melasma and it takes time, but it's very treatable. It does take time and it does take regular care from the doctor. It can't just be like once or twice. It is actually like a 1-year process where you really look at it regularly.
Yeah.
Okay.
Thank you. I'll make an appointment when my sister's here. We'll definitely
Whenever, no worries.
Amita, go ahead.
Yeah, hi, Dr. Kiran. Good evening.
Hi, how are you?
I'm fine. Thank you. How are you doing?
I'm good.
All right. So I just have a tiny question, small question. Now I have very dry skin. So is cleanup okay for dry skin since I have sensitive skin also?
So it
I'm
depends.
not doing any facials because I had a problem last time. I've stopped facials for a very long time. No facials at all. So I'm just thinking about cleanup. Is cleanup okay for a very dry skin, sensitive skin, doctor?
I don't. So again, why don't you treat the sensitivity of your skin? You know, sensitivity.
I'm born with sensitive skin, doctor.
Doesn't matter. It can still be treated. Though everyone uses the word sensitive skin, but they don't even know what the reasoning is. Do you have a baseline eczema? Do you have baseline rosacea? What's the cause? What's the etiology? Are we fixing it? Are we looking at improving the sensitivity? Are we even considering it? You know, like people don't understand that actually it's something that can be treated and improved. Number one. Number two, cleanup. It depends on where you get your cleanup, how they do their cleanup, what kind of cleanup. Is it only on the blackheads? Is it also on whiteheads? Where are they doing it? How are they doing it? Are they going very aggressively? Are they using a bunch of products that might not suit you? There's so many variables in this question when I think about it. For me, if I had you, I would first work on treating your dry skin and your sensitivity, and then I would see about what kind of cleanups.
Yeah, that's the thing. So is cleanup okay? So because there's always a testing, right? A testing has to be done.
As I said, I cannot comment because I don't know where you would get the cleanup, how they would do it, what products they would use. There's a lot that happens in a cleanup. Many times
well, I'm talking about a beauty parlor, which I normally go to. So it depends on the product, is it? What they're using, right?
It depends on their products. They might not suit you. It depends on how many of them. All of them might not suit you. It depends on how they do their extractions. If they do it in a specific way, you might get more inflamed.
I think I'll get back to you, doctor, later. I'll get back to you and tell you what product, or else you can't define it, isn't it?
No, but again, like I said, I don't even know if say they're using the right products, but it just doesn't suit you. You've already said you have a history of sensitive skin. How will you know? Nobody knows. Nobody can predict for you. That's why I said treat the sensitivity of your skin. Treat the dryness of your skin first, improve the baseline, then go experiment with things.
Oh, okay. All right. Thank you.
Welcome.
Hope that helped, Amita. So Samidhi is asking, most sunscreens cause me to break out. What should I do about that?
So it depends. Are you using a gel sunblock? Is it a cream sunblock? Is it a lotion sunblock? Are you using a sunscreen? Which are the ingredients? You're using a sunblock. Usually I would try and start with the sunblock, which is a mineral-based one. The sunscreen agents sometimes can be irritating. And then again, if you feel like if you're getting pimples from sunblock, it could also be the other products. Then you add the sunblock on top, and then you have too much obstruction because it's too many layers. The thing is I think too deeply about things. So there's no like hard and fast answer because I'm so about solving the baseline issue. You get it? So like once the baseline problem cause is there, everything else becomes easier. Then having a sunblock becomes easier, having a moisture, everything becomes easier. But the baseline, like once you identify what you might be allergic to, once we identify, what are the things that are triggering pimples for you? Is there a baseline reason why you're so naturally have a tendency to get pimples? Once we get to that, then everything else becomes easy.
So Sujata is asking, please suggest a good sunblock for normal skin. because we are looking at your skin and you've said that's your number one tip. And we're like, and you said you aggressively moisturize. So we want to understand that too.
So the sunblocks I use on myself is things like FCL Chem Free. I use Eclipse sunblock. I use, I use Beyond Sun Crystal Tomato. I mean, I use any sunblock I'm in the mood for. So it's the sunblock that works for you and that you can use 2 tablespoons of is the sunblock that is good. So I would just get a bunch of trials of sunblocks and see whichever one I can use 2 tablespoons of and be comfortable with, and then buy that one.
And the moisturizing, because you talked about that we need to moisturize. So how much moisturizer should we be using?
I use like 1-2 dollops so that I feel nice and moist. I never use so little that I'd feel dry. I use enough that I feel moist. I've used Ambriolise. I've used Clinical Youth Intensive Cream. I've used Moisturizing Complex. I've used right now I'm using Numis Protective Skin Balm. I mean, I use it all.
So lots of different products. So you're not like, okay, there's a very specific product that you need to have.
No, it's what suits you, right? I mean, I ideally should know my skin by now. And I know I have a tendency towards sensitivity. So if I'm sensitive, then I'll treat my sensitivity and then I'll try products. But otherwise I won't.
So if there are other questions, please do send them in. But my last question is home treatments. Can they give you as good of an effect as the dermatological treatments?
Of course not. How if there's no one monitoring you, what home treatment is there that can give you results? If you have doctor monitoring with people that have been studying and training and treating for decades, their experience allows them to push and create protocols or treatments or customized treatments for you that will give optimal and really exciting results because they know how to minimize the side effects. You don't have that experience. You don't have that comfort. There's no company on earth that's regulated that is going to randomly give you a super high strength product to allow you to mess it up on your face. Okay. They won't take that risk, nor should they, because you're not trained to handle those risks and you're not trained to handle products like that. We are. So of course you're not going to get professional strength stuff at home. And if you do get them and you try them at home, understand that you're increasing your risk. People have been doing like microneedling at home and I've seen this terrible scarring and terrible acne from it because they use any product they want with it. But actually the product you use has to be very specific for microneedling and it has to be intelligent. The things you can use on your skin without microneedling is completely different than what you can use when you microneedle it in. I mean, it's so technical and the amount of detail that we have to know and study is a lot, you know. I know that Google seems like a great encyclopedic reference, but it's really quite problematic for people.
No, because it's got everything. It says yes and no to the same thing on Google.
It's terrible. And then people come in just terrified and then like, it's very hard for them to navigate. And I feel that people really suffer when it comes to, like things like this, but there's no need to because it's actually relatively navigatable.
Now, vitamin C serums, are they worth the hype? Somebody is asking.
I like vitamin C. I don't think I think people that are acne prone should not use a vitamin C serum. They can use a vitamin C water. They can use a vitamin C cream or a fluid, but I do not prescribe vitamin C serums to acne prone patients right off the bat, unless they've already been using one and didn't have a problem. So I'm usually pretty particular about that. I like vitamin C. The vitamin C has to be intelligently created and formulated. Every vitamin C is not created equal. The pH of the product has to be correct. It should be a stabilized vitamin C. It should be stabilized with whatever other ingredients, that are required. Certain vitamin Cs need vitamin E. Certain vitamin Cs don't. Certain vitamin Cs respond better with the addition of ferulic acid. In fact, most do. I mean, it's actually a very technical question. The pH of the product is also very important to have enough vitamin C that is actually bioavailable for your skin. Now, none of that information is going to be available on the bottle, right? So you'll buy like all those 400 rupee vitamin C serums and be like, I'm getting the job done. But, then you're like, why is it not working? Because you didn't buy the right product, right? And you don't know what that is. And that's something that is tough for people because everyone feels like they're saving money. I've got the vitamin C serum. Ideally, I have covered the job, but they don't understand the technicality of it that actually goes into a really good product.
What about all these acids that are coming up? And then what's a good anti-aging regime that we can?
I love the acids, beta hydroxy acids, and beta hydroxy acids are great for reducing oil secretion. Alpha hydroxy acids are great for pigmentation. Some of them are great for hydration. Some of them are great for glow. Polyhydroxy acids are great for glow and, hydration. I love mandelic acid's great. They're all great. They just have to be used in the right percentage and the right pH, balanced correctly so that they're not drying. And sun protection is very important.
And the last question before I take your closing tips, anti-aging routine.
So if you can
And when should we start? Because they're saying now at 25, you should start thinking about aging.
I think 30, frankly. At 25, you start actually the amount of collagen you create and lose. From 25 onwards, you actually lose more collagen than you create. But I actually think if you wear enough sunblock, that's enough until you're 30. And when you start 30, you can add things like retinols and bakuchiol, and you can start increasing in peptides, or you can do it all also. It doesn't hurt you, like if you do a retinol and a peptide and a bit of bakuchiol and some vitamin C, and that's your regimen from the age of 30, it's absolutely fine. It doesn't hurt you. It really doesn't, but, because people are scared, we can always build up so that they feel mentally or emotionally more safe. But the reality is you can combine them intelligently and go really and do it correct, do it really full on without issues, side effects, or problems.
Excellent. And so we're running out of time. Any last thoughts that you'd like to leave the audience with?
You know what? I think the best thing I can tell you is that your goal should do this. You should do this in a way that's practical. If you want to engage in a good skincare routine or you have concerns, go to a doctor or read my book and see what
actually it's quite good. I mean, I was like I said, I'm usually not the type that will say, but 2 or 3 things have got me so intrigued, that especially the hair helmet, these light therapies, especially they can be done at home.
So start at home, no problem, and then move on to a doctor. Do not buy 100 things at one go. Start a few things at a time, 2 things at a time, maybe 3 things at a time, nothing more than that. Start slow. Don't be in a race. There is no race. You are living with yourself till you die. So enjoy the journey. Enjoy the journey, okay? If there's some product, if you bought a great vitamin C serum that your friend said was great, but it didn't work for you, okay, the world hasn't ended. Try a different vitamin C product, okay? There is no trauma that is going to happen. If you have a problem, you can always go to a doctor. Your doctor will fix it. No issues. So A, remove the fear from the experience. B, go about it in a logical way. C, don't do it from a space of being terrified that you're going to be old or you're going to not look nice. Do it from a space of self-care, from a space of, I like feeling good. I like looking good. I like putting creams on, or I don't like putting creams on, but I like feeling good. So I'll put the creams on. Do it from a positive space, because your result will end up that much better. I actually refuse to treat or give treatments to patients that are coming from a very, very negative space, because I don't find the result as good. Their stress levels will actually reduce their result. They'll do half of it and they won't do half because they're terrified, and then they're this and they're that. So I will very often say no. I actually find when people come from a positive space, they do better. They're more compliant with what they need to do, and the results are phenomenally better. So, do that, because fear will never benefit you in the long run.
And Dr. Kiran, people are asking, how do they reach out to you?
Oh, they can my website is there, isyaderm.com. You can DM me on Instagram at Dr. Kiran Says or at isyaderm. We're available. We're available. We're here. We're not going anywhere.
Well, thank you. And thank you so much for a super session. Super motivated.
Thank you so much for having me. I had a great time.
Thank you.
Bye.
Bye-bye.